Mr. President, I'm here to speak about a topic which wherever I go, people speak about, which is the replacement of the Affordable Care Act, or Obamacare as people know it to be, know it by its name, if you will. And clearly we need action. I had a Facebook post from maybe a week or two ago from Brian in Covington, Louisiana. And he said, my family plan is $1,700. And the quote goes on to say how his family cannot afford that $1,700. Rates are going up. I've said time and time again, my friend back in Baton Rouge, who he and his wife, 60 and 61, their quote for their insurance last year was $39,000 for 1 year. Clearly not affordable. And this is not just in Louisiana, it's in Washington, D.C., it's in California, it's across our nation where individual market quotes are going up where they cannot support. Now, most recently, Connecticut insurers are proposing, there's two, proposing rate increases that are 15.2 and 33.8 on average, respectively. In Oregon, they are quoting quotes 22% over 2017, and in Maryland, some insurers are going to raise rates as much as 59% for those individual plans. Now, I'm a physician. I've learned a couple things in my 20 or 30 years of practice. One, the lower cost, the patient must have the power, but two, the insurance must be affordable, and three, that the insurance they receive must be adequate. Now, President Trump totally got this. On the campaign trail, President Trump said time and again what I call his contract with the voter. He wanted folks to maintain coverage with lower premiums, caring for those with pre-existing conditions, and eliminating mandates. And I think President Trump just knew it. I've shorthanded this, if you will, saying that if we focus on lowering premiums and making sure that it passes the Jimmy Kimmel test, as the late-night comedian, when his child was born with a terrible heart problem, immediately got the care that child needed. So if we can have insurance that passes the Jimmy Kimmel test, lowering premiums, taking care of the rest of President Trump's goals, then I think that we can accomplish it. Now, we need to talk to experts, actuaries, those that design insurance plans to make sure we come up with something. But there's something else the president said that I want to focus on. This is just before he took the oath of office. He said people covered under the law, meaning the Affordable Care Act, the Republican replacement, can expect to have great health care. It'll be much simplified. One of the complaints about the Affordable Care Act, it's so complicated. To even log on, 16 pages online with your W-2, if you don't get it, you get booted out. The president said we must have a much simpler way of going about this, much less expensive and much better. Now, what could this look like? Let me propose some conservative solutions that could be in a Republican plan that would achieve the president's goal. First, the patient has to have the power. In my 30 years of practice, I found that if the patient has the power, the system lines up to serve her. One example is price transparency. If we can put in that a provider has to publish the provider's price so that the patient getting the blood test knows the cost of the blood test at that moment and can compare it to someone down the street, we will lower cost. One example just came up in a newspaper out of New Orleans, NOLA.com is their website. A woman went in, got blood test, received a bill weeks later, and her bill was for like $324. She found she could have gotten the same blood test for $34 right down the street. A woman from Texas came up, she said she'd heard me speak of price transparency, the power of negotiating, if you will. The doctor ordered an MRI on her son's shoulder. And she calls up the different places she can have it done, and she gets a price, $667. It's on my Facebook page. She's a little video of her speaking. I got it for $667. Then I remember what you said, that if you pay cash, you get a discount. I called them back. I said, if I pay you cash, will you give me a lower price? They said, oh, pay us cash. We'll cut that $667 to $400. The patient had the power, and so she ended up paying far less for the procedure the doctor ordered. Now, that's one conservative solution. Give the patient the power. Secondly, let states innovate. We need to take all this power that Obamacare brought to Washington, D.C., and push it back out to the states. If we do that, we're going to accomplish something. And let's just acknowledge there's 700,000 people or so in Alaska. And if you took the state of Alaska and you overlaid over, if you took a map of the state of Alaska and you put it over the lower 48, it would stretch from roughly Georgia to the Pacific Ocean. Washington, D.C. has almost the same population as Alaska, and you can walk across the city in a morning. Clearly, you need different solutions for an area you can walk across and an area that you cannot fly across in the same time that you'd walk across Washington, D.C. We have to return power back to the stations. We have to engage doctors and patients so that those patients with complex conditions get their health care managed. I use the example. Take a diabetic. She perhaps developed childhood diabetes. Now she's 35 years old. If a doctor is managing her condition, she works, stays at home, her complications are minimal, her life is much better. If her condition is not managed, she comes to the emergency room 3 times a month with diabetes out of control. That just shoots a hole in the bucket of fiscal responsibility and also in her health. And instead of working, keeping a family, instead, she's coming to the hospital, getting care through the emergency room, which she cannot afford to pay for, and that cost is shifted to everyone else. That is not the way to manage that. We need to engage doctors with patients. Another conservative solution, we need more competition between insurers so that there's not just one insurance company in a market who can therefore set prices, but rather we have multiple. So if we give the patient the power, by giving the patient a credit, a tax credit, that she can use to purchase the insurance she wishes to have, that will create competition as more insurers enter the market. And if we have that competition, those market forces, prices come down. Now there's one more thing. When the president said we have to make things simpler, I think that also includes how we enroll people in insurance. We figured that out on Medicare. Under Medicare, if someone turns 65, they're on Medicare. It could not be simpler. They get a letter, they're on Medicare. If they don't want to, they can call, hey, I don't want to be on Medicare. But as a rule, they're on Medicare. Fortune 500 companies have figured out the same thing. In order to enroll people into retirement plans, they say, listen, you're in the 401k plan unless you choose not to be. And by making it simpler, they get 95% enrollment in retirement plans. Now, you could say, hey, listen, you got to fill out a bunch of forms, and if you don't fill out these forms, you're not going to be enrolled. But that would not work for Medicare. It would not work for 401ks. It has not worked under Obamacare. We need to take those same sort of solutions we found for both Medicare and enrolling people in their retirement and do it for the Republican alternative. The Republican alternative would say, we make it easy to enroll. You're in unless you're out. So if you're eligible for a tax credit, you would receive it. You would then have the insurance. If you were passive about it, you'd have a default policy. But if you were active, you could do more with it. But by doing so, you actually increase the number of people insured. Now, when you increase the pool of those insured, you lower premiums. We have Blue Cross look at our proposal to make it easy to enroll. You're in unless you're out. That would lower premiums by 20% just by expanding the number of those who were insured. 20%. So when President Trump says he wants to continue coverage, caring for those with pre-existing conditions without mandates, and lowering premiums, doing this feature where you are in unless you call us and tell us you don't want to be, making it simple achieves all 4 goals. We would increase coverage. By that, we would lower premiums, taking care of those with pre-existing conditions. And again, using the mechanism that is already used in Medicare and in Fortune 500 companies, making it easy to enroll. There are some who don't want to give states the options, don't want to give patients the options, don't want to make it simple to enroll. They want to replace, if you will, the tyranny of Obamacare, where all this power was taken to Washington, D.C., and states and people were told what they had to do, with a different sort of tyranny, telling states what they can't do. I think we ought to give as much power to the states, as much latitude for the patients to come up with the solutions that work for them. That is the conservative way to go. But I will say, I'm speaking as a conservative, I very much invite our Democratic colleagues to come to the table. There are some of my Democratic colleagues that have said they just want Republicans to work through this and thinking that it might be a political train wreck, that it would work for their advantage. But in those states, there are Americans whose premiums are becoming unaffordable. I mentioned earlier, in Connecticut, premiums rising 15% and 34% this year. In Oregon, as high as 22%. Maryland, as high as 60%. Now, who cares if the person is a Democrat or a Republican? If her premium is increasing 60%, she cannot afford it. So I challenge my Democratic colleagues to get off the sidelines, engage, try and do something, not for political purposes, but for the purpose of that person who's at home struggling to pay the bills and deciding that she can no longer to afford insurance, but perhaps unbeknownst to her, she has a cancer brewing inside her. And just when she decides she can no longer afford coverage because premiums have risen 60%, that is when her cancer is discovered. We have to address this, and it will take us on either side of the aisle, both Democrats and Republicans, to work together. I'll finish with a quote from the fellow from Covington. Brian, on my Facebook page, recall I said him saying that his family plan is $1,700 a month for he, his wife, his 2 children. The ACA, the Affordable Care Act, Obamacare, has brought him to his knees. I hope we can get something done. The middle class is dwindling away. Can everyone just come together and figure this out? This is a cry for help. It is a challenge to Republicans and Democrats to come up with a plan which is not a red plan or a blue plan, but an American plan to address his needs, his wife's needs, and those similar to him across the country. Thank you, Mr. President. I yield back. I ask unanimous consent that Patrick Flanagan, an intern in Senator Kennedy's office, be granted floor privileges for the remainder of the day.
Without objection.
Mr. President, I yield back. And note my colleague from Louisiana to my right.